The College of Medical Laboratory Technologists of Alberta. Sneak peek into the new Continuing Competence Program, version 5. In 2021, extensive research, survey results, and focus group results found 4 main issues with the previous CCP. 1. The model. 2. The assessment. 3. The formatting. And 4. The support. Let's take a look at how these areas are addressed in the new CCP. Version 5. The previous CCP had MLTs predict learning activities a year in advance. The new CCP is more reflective and is based on the CARE model where MLTs create, act, reflect, and enact. Let's take a look at what this involves. Create. MLTs. Reflect on their current or anticipated professional practice environment. Review the CMLTA new standards of practice and code of ethics. Complete the self-assessment. Create one learning plan based on the new standards of practice or code of ethics learning goal. Act. MLTs participate in at least 3 different learning activities throughout the CCP cycle year. One activity must meet the learning plan goal. The other 2 learning activities can be planned or unplanned. Reflect. The MLTs will provide the necessary information regarding the learning activity, such as the dates and topic. Identification of at least one key takeaway from the learning activity. Identification of at least one impact the learning activity had on professional practice. And identification of at least one impact the learning activity had on service users. Remember, the term service user refers to any individual who uses the MLT services, including patients, clients, students, employees, or any other group. Enact. The goal of the CCP is for MLTs to not only identify ways to improve their professional practice, but also apply the knowledge, skill, judgment, and attitude to their professional practice daily, improving public safety in Alberta. Therefore, MLTs will provide at least one application of the learnt knowledge, skill, judgment, and attitude to their professional practice. Issue number 2. The assessment. The previous CCP version used the previous standards of practice that were often hard to apply to a variety of practice settings and interpret for both MLTs and the public. MLTs had to indicate if they were competent or were developing, advancing, or expanding DEV in that standard of practice, which made MLTs feel uneasy because not putting competent made them feel as if they were admitting incompetence. The new CCP version 5 uses the new standards of practice and code of ethics, which are more applicable to the variety of MLT practice areas and are easier for both MLTs and the public to understand. The new assessment requires MLTs to simply select one of the 8 practice standards or the code of ethics on which they want to focus for that year, eliminating the overly complicated competent and DEV options. Please note that the legislated standards are standards that the Government of Alberta specifically mandates through the Health Professions Act. Their format is different from the standards of practice to meet the requirements of the Government of Alberta. These standards are fundamental to any learning objective and cannot be selected for use in a learning plan. Another issue with the old CCP was the formatting. The previous CCP was complex and required many different web pages to be opened at once when completing the CCP. This often led to navigation issues, confusion, and frustration for our members. The new CCP is more streamlined, and its software will be easier for members to complete their CCP. Which leads us to the last issue that was discovered with the previous CCP. Many MLTs felt there was a lack of support and guidance regarding the CCP from the CMLTA. With the launch of the new CCP version 5, the CMLTA will provide MLTs and the public with exactly what is expected to successfully complete the CCP. This includes the release of a new CCP manual, rubric, and worksheet that MLTs can print before the activity and answer the required questions in real time. Thank you for watching the sneak peek into the new CCP version 5. Please stay tuned to the release of new resources and webinars providing additional information regarding the new CCP. If you have any questions or comments, please reach out to the Continuing Competence Manager Natasha Kasongo at natasha@cmlta.org or the office at cmlta@cmlta.org.